First of all, I would like to thank the President for the nice words. Secondly, I would like to thank really the İSAR for the invitation, and I think for the efforts that they are making with this excellent symposium, excellent workshop. I think the choice to have my speech after lunch was done on purpose. It was done on purpose because after lunch, as everybody, you know, it's a bit feeling sleepy. I can say whatever I want at the end of this. At the end of the session, you are going to tell me how nice I was. And secondly, I gave some bribe, bakshish, to the colleague, the next one, in order to get a bit of time more. So like this, I can spend more time than 20 minutes. It was very little. So yes, in order not to lose time with my introduction, I would like to share with you a very small video of 20 seconds, and then I'll talk. Normally, I don't play videos in the beginning because when people look at the videos, they lose the interest. But I think it's an important thing that today you made the choice to do a workshop on the refugees. With the way how we are managing refugees worldwide, we will not have refugees in the coming days because more and more borders are being closing, and you are feeling yourself that in Turkey, you have European Union who is asking Turkey to manage the refugees. And then tomorrow Turkey will ask somebody else to manage. And this is how it goes from one country to another. So just to remind that it's an important point on that. So I would like to share with you a little bit migration and health, bringing in the experience of MSF, Doctors Without Borders, Saner Tanimayan Doktorlar. But before that, I would like to, as most of us are people working in the medical field, including the medical students that are the future doctors, and I think these are the people who are going to continue our work. I would like to share with you, first of all, what's the definition of health? Many times, I repeat it very often because even asking colleagues, how are you? They said, I'm fine. Fine based always on the absence of a disease. And we need to remind ourselves the Wto definition of health that did not change since 1948. Its health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So I think it's an important thing to remind when we discuss about it. The big thing that we are discussing these days, including European Union, it is the famous myths that are persisting, that migrants and refugees are carriers of diseases. They bring to us diseases. Secondly, migrants are a burden on health systems. You know, before I was listening at discussion, how much is the cost? Who is paying the cost? Are they insured, not insured? Our people are not paying the same. Why our people are not being covered? And of course, third is that as more rights we give to these people, more and more refugees are going to come. You touched this morning the issue of the Geneva Convention. Geneva Convention defines the protection of somebody based on persecution, on violence, on a person who needs for protection. It is not based on how much money somebody has. It is not based on how beautiful clothes he's wearing and what nice car he has. I have in my bank account 5 million euros. I have 5 cars, but I'm not safe in my country because I choose to have this agreement. And because protection cannot be provided in my country, I'm coming in Turkey and asking for protection. So it's not based on what I'm wearing, it's not based on what I'm having. So I think it's also to remind the people that the legal terms of refugees protection are needed. And I think sometimes, even though Turkey has been very generous towards millions of Syrian refugees and other nationalities. But keep in mind, the word musafir, it is a nice one. They called me today musafir. I'm not musafir, I'm in my house. I'm at home. If you say the word musafir, it is nice, but musafir, as a gentleman from the Red Crescent said, musafir in Turkey is for 3 days. After 3 days, it's not anymore musafir. So I think it's an important thing, the definition of providing to somebody the role of a status of a refugee is an important thing. Anyway, let's go to our topic. Most of the time, when we talk about refugee and health, two are the main problems that the governments are having a problem. The burden of infectious diseases, and secondly, the cost. How much money we are going to pay for treating these people. On your right, you are seeing a drawing of 1892, when European people from Italy, from Greece, they were going to the United States. This is 1892 and is written, waiting for the cholera. So since that time, was considered that people were bringing cholera in the United States. This is before they were visiting New York. People were being screened. And we need to remind each other that migration, it's a bridge of a global health. It connects health of the communities in the countries of origin, on the countries of transit, and the countries of the final destination. Imagine yourself somebody coming from Afghanistan, goes to Pakistan, to Iran, to Turkey, to Greece, and arrives sometimes to Germany. Imagine how many bridges of Bosphorus have been crossing. Not the 3 bridges, but even 23 bridges. Also, we need to remind each other that as we consider migration or refugees as a bridge of global health, we need to remind that in every country we have a disease and burden. In every country we have health risk. In every country we have health beliefs and behaviors. In every country we have health infrastructures. So when you move from one place to another, you need to keep in mind that play a big role. I was hearing this morning, for example, that you were saying that health, to have good health, you need to have good money. If you have money, you have good health. Where's the money? It's going a bit high. So where the money goes, it's in the north. Where the poverty is, it's in the south. It's moving a bit quick, this one. All of you are medical doctors. If somebody is a patient, he needs to find a doctor. If you are from Malawi, there's one doctor for 100,000 people. So even doctors, nurses, and midwives, that by 2013, WHO calculated 7.2 million people that they were short. By 2035, we will be missing 12.9 million people, healthcare workers. So more and more doctors are moving from the south to the north. So people coming of poor countries, where the burden of diseases is high, they don't have health staff to work with them. That's the proportion of TB and HIV. So let's discuss a little bit about the factors that are influencing the increase of diseases and the infectious diseases on the case reported. We know that from one country to another, we have a different epidemiology of infectious diseases. Today, this morning, I took the plane to come from Athens to Istanbul. It took me 1 hour. But for somebody to come from Afghanistan to Turkey, it needs to lose a lot of migration paths and routes, using smugglers, using traffickers, etc. Also has to do with the pre- and post-entry screening practices. Tell me one country in the world when the people entering as refugees are being received by medical doctors to take care about their health. They are received by army, yes. They are received by police, yes. They are received by coast guards. But you don't see a single doctor to go there and say, hello, what is your problem? Let me assist you. The only way when you see medical doctors checking them is, for example, if you want to go to US to immigrate, they ask you to do all the medical tests before. So you see that we consider always the refugees and migrants as a security or as a threat. Standard of living conditions. If we live in very bad living conditions, that will have an impact on health. I'm not telling to you something new. People, it's true that are coming from countries where the living conditions are difficult. But what we do when we receive these people, when we receive these people, we keep them in worse conditions. We keep them in the warehouses, we keep them in detention centers, we call them musafirkhane. If it's musafirkhane is like this, you know, like I don't want to be a musafir then. So it is an important thing to consider about the living conditions. Then we talk about access to healthcare. What is access to healthcare? If it is an emergency, you are allowed to go to a hospital. What is an emergency? A doctor can decide an emergency. I have an emergency medical case. Do I need to have bleeding? Do I need to have a trauma in order to be an emergency? I have malaria at the moment. If you don't see me as a doctor, and you don't diagnose me that I have malaria, that's an emergency that you are not considering. So most of the states are including access to healthcare only for the emergency situations. And then, of course, it has to do with the surveillance system. How many, since when Turkey, for example, is receiving migrants and refugees? Since 1980. With the collapse of Soviet Union, with the wars in the region and all this stuff. How far, for example, the practices and the surveillance system have been changing? So definitely, migrants will have a different and more complex health needs, but mobility does not cause ill health. My mobility today with an airplane with 1 hour did not cause me ill health. So we need to consider migration as a social determinant of health. And there, we need to always to analyze the issues that are related with that. We have to talk about anti-migrant sentiment and xenophobia. We have to talk about lack of social protection, including access to health care. We have to talk about the legal status of these people in the countries that they are. And then we come to the discussion. Everybody says these people are bringing us tuberculosis. They are bringing us HIV. They are bringing us STIs. They are bringing us malaria. And they are bringing, of course, what we discussed this morning, chronic diseases, because they come from Syria and Iraq, and they have the same profile like us. Where do you base, by stigmatizing, saying that people, migrants and refugees are bringing us tuberculosis? Do you have data? No. You don't screen them. You don't work with them. How can you decide that these people are bringing you diseases? Don't you have tuberculosis in Turkey and Greece? Yes, you do. Don't you have HIV/AIDS? Yes, you do. Don't you have STIs? Yes, you do. Do you have hepatitis B and C? Yes, you do. So why suddenly these are bringing and you don't have it? Also, we have to keep in mind that when the refugees arrived in Europe this 2015, the German authorities, they were not afraid that Syrians are going to bring measles in the country. There was an outbreak of measles in Germany, and they were afraid that the Syrians are going to get measles because they were not properly vaccinated. And then, of course, the media comes with xenophobia, saying the migrants are bringing. And there's an important thing that first who start stigmatization of migrants and refugees, somebody can help? So the first who start is the government officials. How many times you as professors, I'm just asking, maybe you did it, I did not follow Turkish TV. How many times you went to the TV saying, based on our data, on work of our university, migrants and refugees are healthy, or they bring diseases? Never. But the Minister of Health, the politicians, the member of the parliament, and the media, they go almost every day and they report about it. So like this, normally each of us, because we have all these people who are dangerous, we need to walk in the street like that. We have to wear this type of uniforms in order to be protecting from migrants and refugees. I think it's an important thing that into our public, my mother, when she watches news and she reads newspapers, she says the people are dangerous because this is what the newspaper is telling and this is what the politicians are saying. Also, at the same time, there are a lot of barriers to access to healthcare that I just mentioned before. Because Turkey is a country who wants to enter the European Union. In the European Union, most of the countries, they don't access migrants and refugees, they cannot access for free the healthcare, even though they have been agreeing on European level and even on the World Health Organization level that everybody has to have an equality to access to healthcare. Now, most of the countries are afraid to provide access to healthcare for migrants and refugees because they say that this will be increasing the cost of the healthcare system. European Union did a study the last year, it's available by the Fundamental Rights Agency in Germany, in Sweden, and in Greece. And with this study, they analyzed saying that saving of approximately 9% over the space of 1 year, 13% after 5 years, and 16% over a lifetime is the saving that the public healthcare system will have if we allow people to have access to health. And of course, allowing somebody to have treatment of hypertension or having access to prenatal care provided saving from 48% to 69%. To give you an example, I have hypertension. My treatment, it costs me 30 liras a month. I take cheap drugs, generics. For a year, I need 360 liras. If I don't have these 360 liras to maintain my blood pressure under control, together with the diet, not to add salt and all this stuff, the doctor says, I go every day to the emergency unit because my blood pressure is going up and down. And because it's an emergency, they will do something to me. And then I got a heart attack, and then one day I had a stroke. So they took me to the emergency service, and the state had to pay 50,000 Turkish liras. So what is better, to give 360 liras a year or to give 50,000? So I think everybody knows about it, but it's a political decision that somebody comes out and says, yes, access to everybody. As a medical doctors, both on European level and in the world level, we have been signing agreements that as health professionals, we will ensure the oath of Hippocrates and will provide everybody access. We are not doing it. In European level, in WHO level, in IOM level, they have been signing resolutions with the left hand, and with the right hand, they don't implement them. Of course, on the healthcare of the migrants, there are many issues that are interlinked. Is the monitoring of the migrants' health, is the policy and the legal framework, is how the healthcare systems of our countries are being adapting to the needs of the people. Because if your healthcare system, the hospitals, the health centers, are made to cover the needs of your local population, this health system are not there to manage the life of 3 million Syrians coming to the country. So you need to adapt the system to the needs of the people. And of course, has to do with partnership and the networks. Now, to go a bit of in the practice, because it was nice, the theory that I provided to you, I would like to share with you a little bit of the experience of MSF working with migrants and refugees. This is an experience of an organization that was founded in 1971 in order to provide emergency medical care to people. We work with migrants and refugees, but we work with them as people, or people in the move, and we care also for their dignity. So we are not discussing the issue of the phenomenon of the migration. At the same time, we take care of the most vulnerable ones. Pregnant women, children under 5, people with special needs, senior citizens. And as I mentioned before, there are a lot of cumulative vulnerabilities that these people are having. Most of them, they have unmet medical and humanitarian needs. And of course, what we are missing everywhere is lack of the political will to deal with these people. You are facing today the famous EU-Turkey deal. You will make some money out of this EU-Turkey deal. 15,000 people are stuck on the Greek islands. But you know very well that one road is closed, another one opens. It's like the water pipe. You push in one way, it comes from another way. Secondly, what we see today, we see more and more people with refugee profile. If we see today in Greece, yesterday arrived a lady from Iraq, 114 years old. Do you think that she is a migrant that's coming to get my job, or she is there to do prostitution? So that is changing the profile of people. And of course, what we see more and more is the violence. People are being pushed at the borders, in every borders, the borders that I showed you in the first video. And of course, we are seeing a lot of people dying. I can tell you one thing. If 15 people that are dying a day in Mediterranean Sea and in the Aegean Sea would be dying of Ebola or any infectious disease, I'm sure you'll not be here in the symposium with me. You'll be on the sea to find out what is this disease that is coming and is bringing to us. But because they are dying of trying to cross the borders, we don't care. You mentioned before Alan Kurdi. You know how many Alan Kurdis we see every day? Plenty of them. So that is something also that we need to keep in mind. And as doctors, what we've been seeing the use of deterrence, detention. We've been seeing the poor reception conditions. We see closing of opening of the borders, and we see the pushbacks of the people. And these restrictive policies that are being implementing internationally. You know, after EU-Turkey deal, EU signed the deal with Nigeria, with Ethiopia, with Libya. So the externalization of the problem. So we say in our village, if they come to the village, we say far from my house. So everybody wants it far, far from his house. And what we see as the consequences of these policies, we see lack of access to health, we see ill treatment, we see torture, and we see a lot of medical issues that are related with these policies. What we do as MSF, as Doctors Without Borders, we do medical screening at arrival, we do provide primary health care, we do referrals and accompaniment to the secondary health care, we treat sexual gender-based violence, we work on detention centers, provide mental health, non-food items, toilets, water, shelter, transportations, and rehabilitation also of the victims of torture. The pictures you see there are not coming from Africa. The pictures we see there are pictures from Europe, the Europe that we are dreaming for. Today in Greece, we have about 50,000 people who have been stacked and are being spread all around the country. The 15,000, 1-5, are in the islands. They are expecting to send back to Turkey. So wait for the other 15,000 to come back. So this is part of EU-Turkey deal that have been 7 months stuck at the borders. So this is the children who are being locked in the detention center. This is the children that are playing. This is the playground that children are having. This is the house that they are having. This is their toilet that they are having. And this is the new migrant that are coming to get our jobs. So is this a migrant that is coming to find a job? No, this is the people who is fleeing a war. There's their laundry of the people. That's the dignity of the people. And our operations during this time have been from Turkey. So you know that we are present in Kilis, we are present in Gaziantep, we are present in Suruç, and we are present in the Greek islands. We are present in Serbia, in Italy, in France, trying to assist these people, including the rescue operations that we do with our boats. Because I mentioned before about vulnerabilities. 16% of the people that we provided primary health care were vulnerable people, children under 5, pregnant women, and unaccompanied minors. Do they bring diseases? You can see what diseases they bring. 93% of the symptoms were onset during the migration trip. And the problems that they are bringing are upper respiratory tract infection, trauma, gastrointestinal problems, and skin diseases, because when they come wet from the sea, they don't have a house to stay, they don't have food to eat, they don't have a toilet, they don't have safe water. So problems are related and created because of living conditions. The people that we meet, they've been facing violence before their journey. They face also violence during the journey, not only once, many times. Both from the smugglers, both from their community, but also from the state actors. Police, coast guards, administrative staff, including sexual violence. So it's not just the bad smugglers who are doing it, it's also the state actors who are doing it. And because I mentioned before about detention, it's something that you have to be careful, because the guy behind the doors, he is an ISIS terrorist. Just to be careful of it. During 2008 to 2014, we treated 9,921 people in detention centers. In 2015 and 16, this is the picture from European Union, where children are being marked like the Jews that were marked during the Second World War. They don't have a name, they have a number. If you go in a detention center, or if you go in a camp and you ask about Muhammad, Apostolos or Hassan, they don't know it. If you ask about number 14, they will call 14A, and everybody will look at this hand and will find, I am the 14A. So that is, and this is as a purpose. People in Europe are numbers, are not human beings. People have a name. Today they gave me, as soon as I came in the Congress, they gave me this stuff. And I was wondering, why they did not give me a number? They give me a name. I have a name, and everybody has a name. So that's, dignity is a very important thing. And by treating in that way, it is to degrade people. And by keeping people, providing them this type of toilet and this type of living conditions, this is made on purpose. And this is happening all around Europe. And with the same money that was happening in Europe, they were building up Musafir Khane in Tunja, in Kumkapi, in Izmir. You have many of these Musafir Khane that are in the same picture. So I think it's important to remind that the problem has the same face everywhere. The states, they deal with the same way. And here I remind you what is the European Center for Disease Control was mentioning about the diseases. So they're mentioning that the risk for increasing the diseases, it is the living conditions, the overcrowding, the lack of hygiene, lack of basic supplies. Do you think that the European Union does not have these supplies? They give money to you. No, they do, but they don't want to do it. So you can see that in detention facilities, 63% of the total diagnoses were linked directly and indirectly with the living conditions. So what is an important thing that all of us in this symposium today, it's important to expose the medical and humanitarian consequences of the restrictive migration and asylum policies. We are doctors, we are not politicians. But it's important to tell the politicians what is happening with the health of people. I think it's important that we expose the inadequate state response. I think it's an important thing to promote what is an important human beings. We are humans. First, as a doctor, if I come tomorrow to your hospital, you're not going to ask me what is my nationality. You're going to ask me what do I feel. That the doctor needs to do. And of course, it's a very important thing speaking out and discussing. And I think today I thank you for giving me the opportunity to share with you, because I think speaking out about what is happening and what we need to do with that, I think it's important to maintain this type of a dialogue. It's not a matter of doing policies. But of course, all of us, we have limitations. We have limitations because, first of all, media does not talk about it. Public opinion, it is not open to migrants and refugees, because media and politicians are giving them something different. And of course, it's an important thing that what we face today is lack of actors on the ground. Even though there is money available, even though there are NGOs or other state actors, we see more and more difficulties in order to access the needs of these people. So if you have nothing better to do, I would advise to you to read these two reports. The one is called Invisible Suffering, what prescribes what is happening in detention centers. And then another report is Obstacles Course to Europe, prescribing the barriers and difficulties that people on the move are facing to reach Europe. And of course, we need to remind as doctors that migrants are not carriers of diseases. Even if they have a medical problem, we need to address it. Migrants are not, and refugees are not a burden to healthcare systems. Because first of all, with the law that we have in place, we are not allowing them to access the healthcare system. And third, it is not the toilet and the soap and the tent that is going to let people to come. People, they are not coming from Syria to Turkey or to Greece because we are giving them a nice tent. They're coming because Aleppo today, of 250,000 people, has 35 doctors. 11 ambulances to transport 250,000 people. So this is what we need to tell to the world, because today the world is becoming immune to a situation where the deaths of the people, deaths of the children, it is not making any change on their mind. For more information, you could visit, we have a website in Turkish, and we have an office in Kadıköy. It's Dr. You can find us on the Facebook and on Twitter in order to get more information in Turkish this time. And I would like to thank you very much for your attention.